everyone, welcome to Sunday Q&A with Dr. Rick. So today's endeavor is just to get my butt on Mount Hoy to do some repeaters. In exactly 60 days I'll be going to Colorado. I am just not motivated to exercise. High altitude usually means less oxygen, means more work, a big time perceived exertion, and not fun if you're not training. Problem with me, and I think a lot of other patients, is that COVID and isolation has kept motivation low, and then there's no place to go work out. I just called my Planet Fitness in Bloomingdale that I go to, and I heard they're open, or the salesman said they're open from 6 to 7, I think, or 6 to 8. I would wait. I'd really be careful. I think that there is a mini flare statistically in positive cases. I'm not sure if that's positive cases that are symptomatic or just positive test cases. Honestly, in this area, I haven't had too many people that are complaining about symptoms of viral respiratory infection. I think a couple states that opened early are seeing numbers. Again, the question is whether it's positive cases or whether it's positive cases that are symptomatic. Some people have been required to get tested to get back to work. Even though my telephone lines are not that bad with regards to sick, fevers, cough, shortness of breath, we'll see what happens. I think, honestly, if the local area and statistics of the U.S. cases and people infected gets by 4th of July weekend, we should be okay. How to get a medical marijuana card. There's 4 different types. Medical cannabis pilot program, and it was started about 3 years ago for cannabis to be medicinal. And that card, typically you have to fall into certain conditions, debilitating conditions that are reviewed by a physician, and then the state allows you up to 3 years for a card. That allows you to get into several different dispensaries. You have to pick one as your pharmaceutical dispensary, and there's a lot in the suburban area and in downtown Chicago now. So that's one card. If you don't have any of those debilitating conditions, and there's a lot of conditions there, check them out on IDPH. And then there's another card, a temporary 90-day, it's called the OAPP. I'll put a link down below. And that one is meant to hopefully guide you, with your doctor's help, to get off of opioids. Because about 2 years ago, there's a lot of people dying. And I'm sure there still are. But big push by the government, at least in Illinois, to allow people that have chronic pain to transition off their opioids onto medical cannabis. You can only get certified and carry a card for 90 days. And usually after every expiration, you have to go back to your doctor and get recertified for another 90. That does not require debilitating conditions. Just requires a prescription or potential use of a chronic pain pill to get certified. A lot easier, less hoops to jump through, but only 90 days at a time. So the office visit is cheaper. Usually it's $150, but with the state allowing me to do this by internet or phone, it's $50. I mean, I'm a terrible salesman, but that gets you covered for 90 days. And I think the state only charges you $10 to get the card, so pretty good deal. The other one, the MCPP card, is $200 fee, usually $270, but now, because of COVID times, I charge $200 to certify, authorize, essentially for a visit. And then the state charges you, I think, $100 for 1 year, $200 for 2 years, $270 for 3 years, I think. if you are taking care of somebody with a card and they are debilitated, you're supposed to be their gopher. So you go to pick up their product. But like a son or a spouse or a caregiver, healthcare provider like myself, we will go to the dispensary to pick up for patients whatever they need for tolerating symptoms. Caregiver cards are much cheaper. You don't have to see a doctor, and you just have to have, I think it's like 25 bucks for a year, 75 for 3 years, but you have to have somebody designate you as a caregiver. What I've seen people do, I'm not suggesting this, is one person is a designated patient and the caregiver, who pays much less, is the gopher, and they split the fees, which I think is fair. Again, the patient with a card that needs certification for 1 to 3 years still has to see a doctor for physician review, still has to pay that big fee to the state to get their card for a while. The caregiver does not have to see a doctor, but just has to pay the state 25 to 75 bucks. Pretty good deal. I've only filled out one of those. I'm not sure how long it took, but I hope it's fast, because the idea of trying to help somebody in hospice transition to death, I mean, you got to accelerate and have them pain-free, hopefully. So, or at least suffering less. So hopefully that's quick. I didn't follow up with my patient. I think they passed away already. So those are the 4 different types of cards for medical cannabis. Third question of the day. Should we get blood tests before starting our new life? And I tell you, I have not been motivated to do anything. A couple other patients, like myself, have gained weight, fallen off the training routine and the diet. Listen, if your insurance allows to get blood testing and you want a snapshot of how life is before we start on our endeavor, I think it's fair to get a couple tests. Fasting 12 hours, first in the morning, I get hormones. That means adrenals, gonads, thyroid, a couple deficiency tests, lipids, insulin. If you're a faster, I get beta-hydroxybutyrate, maybe leptin. So those are the initiating tests before making the change. If you don't have insurance, you have to pay out of pocket, heck with it. Just do initial measurements, your BMI, waist to hip ratio, blood pressure, pulse rate, maybe the same vital signs when you 5 minutes of exercise, just to see how your heart is responding, and that'll be good enough. So then we set out for a 3-month change. I think average American, if you make it through a season, 3 months, that says you're in it to win it. So at that point in time, then I do the blood tests, just in case my patients don't notice any change and they're getting frustrated. At least the blood test should show direction. And also for some patients who just want validation, it's awesome to see blood tests start to chip away, in addition to blood pressure, heart rate lowering, scale changing, BMI. So it is important to see metrics, but not at the sacrifice of paying a ton of money. So that's what I would do with regards to blood testing. All right, so that's it for today. I got, I don't know how many more, 7 more rounds. So gotta do it, gotta stay in shape. So stay healthy. After 4th of July, have a good summer.